Health Awareness Month gets underway. The state of Texas is working on improving mental health in rural communities. Texas Health and Human Services started their Rural Mental Health Initiative last September, and while working in West Texas, they uncovered some real challenges. Tyler Dupnick joins us now with more on what kind of hurdles they're trying to overcome. Tyler.
Yeah, Crystal, they've met with some mental health centers here, and what they found is there are quite a few challenges helping people deal with their issues. I spoke with the Deputy Associate Commissioner for the Rural Mental Health Initiative, Robert Dole, earlier today, and he tells me some progress has been made, but there's still a lot of work that needs to be done.
And I think that's what's really made the big difference, is that we're able to affect change on a systemic level that eventually will affect the local level.
As Texas Health and Human Services continues mental health efforts in rural communities, their focus began with getting local perspectives to identify gaps and challenges. In West Texas, broadband, transportation, and housing are several to overcome, along with the workforce.
The local mental health authorities are looking at other ways that they can hire and retain an adequate workforce. And part of that is getting creative by looking at using certified peer specialists to engage with people. These are people who are trained and certified to provide recovery services, and they're people with lived experience in recovery from a mental health condition.
Permia Care in Midland helped identify strategies for another key factor in the region, criminal justice diversion.
Diverting people with a mental health condition away from criminal justice settings is a big priority for all the centers we work with out there, and all of them are doing incredible work around keeping people out of jail and into recovery.
Those in need of assistance are seeing the distance issues in rural areas cut down.
Now the law enforcement can meet directly with the clinician via televideo and have the person screened and determine the best place for that person to be taken.
May is Mental Health Awareness Month, and with that being said, how important is this topic in today's society?
Oh, it's essential. I think that the reality is people are really struggling and suffering, and they need to know that help is available and that they can recover and that they can build a life worth living. Mental health is more than just seeing a psychiatrist or seeing a therapist. It's about having a sense of well-being, a sense of purpose, and a sense of direction in one's life.
Now, Dole also mentioned to me in our conversation that people are more comfortable talking about mental health now than ever before, which is important in rural communities where the stigma is so profound. Texas Health and Human Services is also assisting West Texas centers in Big Spring with creating a diversion center for law enforcement to bring people with mental health conditions in for screenings. Crystal.